So my name's Nikki from Occupational Therapy. I'm just going to go through with you what our role is within the joint replacement surgery. So we will educate you on hip precautions and how they'll impact you on your everyday activities following your surgery. We'll advise you on techniques to help you follow your hip precautions and complete your activities of daily living. We'll review your home information form with you via phone and provide any required equipment. And we'll see you on the ward post-op to ensure that you can manage your activities of daily living prior to your discharge home. So the following slides will detail the post-operative precautions. There's a risk of dislocation following your surgery if you do not follow the hip precautions, and these must be kept for 12 weeks. In some cases, the surgeons may tell you slightly differently, but that will be discussed with you on an individual basis. You can follow these precautions and still safely carry on with independent tasks once you're at home, and we'll go through with you how you'll be able to do this. So the first one is not to bend your hip past 90 degrees. You can see there's some pictures on the screen here. The picture in the middle and the picture on the right show someone bending down too far. So bending down to put things on, put things in and out of the fridge, to be putting your shoes and socks on, or to be dressing your lower half. We'll show you ways around this. And things like getting in and out of the fridge, you'll have to think about where you're going to place items within the fridge. When you're standing up from a chair and sitting down on a chair, as you can see on the picture on the left, you'll need to be careful that you don't bend forwards when you're doing this, so that you don't bend your hip too much. And also we'll go through with you individually how we'll make sure that your chair is the correct height. If you sat on a chair too low, your hips would be below your knees, as you can see on the picture on the left. This is what we don't want to happen. The picture on the right, you can see that hips are just above the knees, and that's a good sitting position. When you're lying down, your legs need to be kept straight rather than bending them up in front of you. The next one is we don't want you to cross your legs, as you can see in the picture here, as this will put too much pressure on the outside of your hip, and this is either at the knees or the ankles. We also don't want you twisting your upper body when either sitting or standing, so you need to be careful to set up home, so anything that you're going to need to get hold of is within easy reach and won't require you to twist.
Following your surgery, you need to think about how you're going to get yourself washed. Depending on your surgeon, you may have a waterproof dressing in place. If you do, and you have a shower cubicle, then if you feel comfortable getting in and out of the shower, you can return to showering straight away, although care needs to be taken not to soak the dressing. If your dressing is not waterproof, then you'll need to strip wash for roughly the first 2 weeks, or until you've had your clips or sutures removed and the wound is allowed to get wet. Unfortunately, if you normally use the bath or your shower is over the bath, you will need to continue to strip wash at the sink for the 3 months you need to follow the hip precautions for.
Things we'd like you to think about before you come in for your operation. We'd like you to think about setting up your home so that it's suitable and you're going to be able to manage when you get home. You need to think about lifting up any small rugs and make sure that carpets are not loose so there's nothing to trip on. You need to make sure the banister rail is nice and secure. You need to make sure your house isn't too cluttered so that there's space for you to walk around the home with your walking aids, such as a walking frame or crutches when you first get home. We'll also need you to be sleeping on your back initially when you go home from hospital to protect your hip. This might mean that you need a few extra pillows just to be able to get comfortable on your back. If there's space, we always recommend having a suitable chair in the kitchen and bathroom, so you can sit in the kitchen whilst you're waiting for the kettle to boil, or in the bathroom so you can sit and have a strip wash in front of the sink. You need to think about how you're going to eat after your operation, so you need to think about either stocking up the fridge and freezer with ready meals, or cooking portions and freezing, or having somebody who's going to be able to help you out and provide your meals. As for moving things around the home, you're going to be walking with a walking aid initially, so you need your hands to be free. We recommend using a small backpack to carry items around. For example, if you want to get a cup of tea through the living room, you can put it in a flask and carry it in a rucksack on your back. You also need to think about whether you're going to need any help. So thinking about whether you're going to need help preparing meals, doing the shopping, laying a fire and doing your laundry. Go through, have a think about each individual thing that you normally do and how you're going to do this after your operation.
We will send you a home information form in the post asking you details about your home setup. Please could you complete this and bring it back to your pre-op assessment appointment, where an OT will see you and go through this with you. We will then order any equipment we identify and have this delivered to your house. When measuring your furniture, the bed, chair and the toilet, please ensure you measure the bed and chair when you are sat on them so that we get the compressed height. If you do not receive your equipment prior to your surgery, please call us on this number, as not having the equipment may delay your return home following your surgery.